Hey guys, happy Valentine's Day!
So this week's video is about epilepsy.
Epilepsy is a condition that causes abnormal brain activity. It can lead to seizures, sensations, time periods of unusual behavior, and loss of awareness. This condition affects the central nervous system, which classifies it as a neurological disorder.
The cause of epilepsy cannot be traced in about 50% of people who suffer from it. However, the cause can be seen in the other half. There are various factors that cause epilepsy. First, genetics plays a major role, as sometimes it may run in the family. Scientists found ways to trace epilepsy to a certain pair of genes that make a person sensitive to environmental conditions and that trigger seizures. Next, trauma to the head can also cause epilepsy. Certain brain conditions that can damage the brain are also a leading cause of epilepsy. These brain conditions can include brain tumors and strokes. Infectious diseases are also a leading cause, along with prenatal injuries. A prenatal injury is when a baby suffers from multiple conditions such as infection, poor oxygen, poor nutrition, and other conditions. Lastly, disorders such as autism and neurofibromatosis are also leading causes of epilepsy. Although the causes aren't traceable for everyone, the causes listed above are the main ones.
Seizures can impact any processes that the brain controls, since epilepsy is abnormal activity of that organ. Epileptic signs and symptoms are classified according to the type of seizure that a person is having, and these signs and symptoms are usually the same every time they occur, since epilepsy causes the same type of seizures to occur repetitively, which means that the signs and symptoms also remain the same during these episodes. There are two classifications for the type of seizures, and those are focal seizures and generalized seizures. Seizures are divided into these groups based on how the abnormal activity in the brain starts. Even though there are usually different signs and symptoms based off each type of seizure, here are some common ones that may occur with most of them. Onset of temporary confusion, staring off into space, uncontrolled jerking movements of the limbs, unconsciousness, impaired awareness, and psychic manifestations such as anxiety, fear, and déjà vu. Focal seizures are caused by abnormal activity that affects only one area of the brain. They have two more classifications in this section: focal seizures without unconsciousness and focal seizures with impaired awareness. Focal seizures without unconsciousness are partial seizures where a person is still conscious, but they have signs and symptoms such as emotion changes, alterations of the five senses, uncontrollable jerking movements of some body parts, and spontaneous sensory manifestations. Focal seizures without awareness are partial seizures that impact consciousness and awareness. The signs and symptoms that they present are staring spells, abnormal responses to the environment, and repetitive movements. Generalized seizures affect all of the areas of the brain, and there are 6 classifications to this type of seizure. The first classification is absence seizures, and these usually happen in children, and they can cause signs and symptoms such as staring spells, small movements, impaired awareness, and these seizures can also occur in clusters. The second classification is tonic seizures, and these can cause the muscles to turn stiff. They especially affect the back, arm, and leg muscles, and they can cause a person to collapse. The third classification is atonic seizures, which are also known as drop seizures, and they cause loss of muscle control and can also cause a person to collapse. The fourth classification is clonic seizures, and these can cause jerking movements of the muscles, and they especially affect the neck, face, and arms. The fifth classification is myoclonic seizures, and these are usually characterized by brief jerks or twitches of the arms and legs. The sixth classification is tonic seizures, and these are usually the most dramatic type of seizures. They can cause a person to become unconscious, body stiffness, body shakes, loss of bladder control, and cause them to bite their tongue.
To diagnose this condition, doctors will review your symptoms and your medical history. Evaluations such as neurological exams or blood tests may also help diagnose this condition, because they can test for certain genes and they can test for behavior. Other tests may be ordered to detect brain abnormalities. These tests can include electroencephalograms, high-density EEGs, CT scans, MRIs, functional MRIs, PET scans, SPECT scans, and neuropsychological exams. EEGs are one of the most common tests used to diagnose this condition. In an EEG, Electrodes are placed in your brain to record the brain activity. This can detect abnormal brain activity and seizures. In high-density EEGs, electrodes are placed closer in the brain and they can detect what parts of the brain are affected by these seizures. CT scans use X-rays to get pictures of your brain. These images reveal abnormal activity in the brain caused by seizures, tumors, bleeding, and cysts. Similarly, MRIs use magnet waves and radio waves to get images of the brain. This can help see various lesions and abnormalities as well. Functional MRIs detect changes in the blood flow and other abnormalities. Next, PET scans use radioactive material and they inject it into the vein to help see the active areas of the brain. SPECS also use a radioactive material to get 3D images of the blood flow in your brain. And lastly, neuropsychological tests assess thinking and behavior to determine which parts of the brain are affected by the seizures. Various tests can also help determine where the seizure started in the brain. These tests include statistical parametric mapping, Curry analysis, and MEGS. Parametric mapping compares the areas of the brain that have more metabolism during seizures to normal brains. This gives an idea of where the seizures begin. In a Curry analysis, EEG data is taken and projected onto an MRI to show where the seizures are starting. Lastly, MEGS measure the magnetic fields made by activity to identify the area where it started. By taking these tests, a doctor can pinpoint where the seizure started and possibly give you the best treatment there is. Epilepsy is usually treated by medication, surgeries, and other forms of treatment. Many can prevent their seizures by taking anti-epileptic medication, or they can lower the intensity of their seizures by taking the same medicine. Many children and adults will discontinue this medicine after they go a few years without getting seizures. However, it has to be recommended by a doctor. Choosing the right medication for you is very hard, so the doctor will prescribe it for you by considering factors such as age, gender, and the severity of your seizures. These anti-epileptic medications are very effective, however, they do come with a few side effects. These side effects include fatigue, dizziness, weight gain, loss of bone density, rashes, speech problems, and memory problems. Severe side effects may include depression, suicidal thoughts, severe rashes, and inflammation to the organs. Therefore, you should only take the medication if your doctor prescribes it. Also, make sure to tell your doctor if you are experiencing some of these side effects and tell them if you are having migraines. More than 50% of people will become seizure-free during their first medication, but if they don't work, surgery and follow-ups may be needed. An important surgery called epilepsy surgery, where a surgeon removes a part of the brain causing seizures, may be needed. These surgeries are usually performed when the seizure is in a small area or when the small area doesn't really affect your vital functions. These vital functions may include speech, motor control, vision, hearing, and language. Then you may be able to take a few drugs and reduce the dosage after your surgery. In very few cases, surgery may cause complications, such as problems to your cognitive abilities.
Therapy is an alternate treatment option to medications and surgery. Some examples of therapies that can be used to treat epilepsy are vagus nerve stimulation, ketogenic diet, and deep brain stimulation. Vagus nerve stimulation helps epilepsy since the vagus nerve stimulator, which is a medical device, is implanted below the skin in the thoracic region, and the wires of this device connect to the vagus nerve and send electrical energy to the brain through the nerve, and this can decrease the amount of seizures. Although, this treatment can still require a patient to take the medications, but the dosage of it can be reduced. A ketogenic diet can help reduce seizures since it's high in fat intake and low in carbohydrate intake. Deep brain stimulation can help epilepsy since it involves the implantation of electrodes in a certain area of the brain, and these can send electrical impulses to the brain, and that can help decrease the chance of seizures. Some complications of seizures are falling, since a person can collapse during a seizure and that can cause severe injuries such as head trauma or bone breaks. Drowning can also happen since having epilepsy can increase a person's chance of drowning by 15 to 19 times, since a risk of having a seizure while swimming, bathing, or doing any other water-related activities can occur. Car accidents are also a complication of seizures since having a seizure while driving can cause someone to have impaired awareness and lose control, and that can cause car crashes. Problems with pregnancy are possible due to seizures that can occur during pregnancy, which put both the baby and the mother at risk, and medications are also risky to take since they can increase the baby's chance of having birth defects. Epilepsy can also cause issues with mental health, since this condition can take a huge toll on the person and result in depression, anxiety, and many more. Status epilepticus is also a condition that can happen if a seizure spans more than 5 minutes, or if they occur in clusters and the person doesn't become conscious in between them, and this condition can higher someone's risk of permanent brain damage or death. The last complication is sudden unexpected death that doesn't have a known cause.
Some risk factors may increase the chance of getting epilepsy. Epilepsy is common in children and older adults, and it is very common if it runs in your family. Head injuries may also give you a higher chance, and other conditions such as stroke, dementia, vascular diseases, brain infections, and seizures may give you a higher chance of getting epilepsy. This is because they may affect the blood vessels. These are the risk factors of epilepsy, as certain conditions may increase the chance.
Epilepsy is a dangerous condition that affects many people, so it's important to be educated about it.
Thanks for watching. We hope you learned new things from this video. And also, don't forget to comment down below if you have any future ideas or if you would like to learn about a new disease that we haven't done yet.
Make sure to like the video and subscribe.
Also, check out our Instagram, and if you want, the citations will also be in the description along with the Instagram handle.
Bye!
Bye!